And today I'm going to talk about allergic rhinitis. And allergic rhinitis is a chronic disease, and it's an allergic disease of the nose and the nasal passages. And this is previously known or commonly known as hay fever. And allergic rhinitis is increasingly common in Australia, and up to 25% of the Australian population will have some form of allergic rhinitis. And it's actually becoming more common than asthma, and it costs our community and our government more than asthma does as well. So it's certainly not a disease to be taken lightly. Its impact on our quality of life can actually be quite serious as well. It can affect our productivity, our ability to sleep, and our ability to drive. Now, allergic rhinitis is when our nose and the lining of our nose reacts to something that normally wouldn't cause a problem, such as dust mite or pollens. And this doesn't happen in everybody, but in certain people that do suffer from allergic rhinitis, the symptoms are a blocked nose, a runny nose, sneezing, a difficulty thinking, postnasal drip or mucus running down the back of your throat, as well as an itchy nose, and sometimes it can also cause an itchy eyes, watery eyes, and your eyes to look red as well. So if you do think you have any of these symptoms, particularly if they're on an ongoing basis or recur at a certain time every year, the first step is to go and see your GP and to discuss this with your GP. And your GP can then start you on some simple treatments that might be all you need to help you. However, if this doesn't help you, or you have unusual symptoms, then your GP might want to refer you on to an ear, nose and throat surgeon who has an interest in rhinology or the nose, pathology of the nose or diseases of the nose, and allergies. So the treatment options that are available once you are diagnosed are many, and we talk about a step up and a step down approach. And what that means is we start with simple things and then we change or alter them until you are feeling a lot better. And then once you're feeling better, we start to see if we can wind down these treatments. Now, initially, the first and most simple treatment is to avoid any exposure to this allergen or to reduce your exposure to this allergen. And it really depends on what you're allergic to as to how we do this. If that doesn't work, or if it's not 100% effective, then we look at medications. And this can be something as simple as a saline nasal spray or saline nose wash, or it can be other nasal sprays as well as tablets, and occasionally eye drops can also help. Every now and again, these aren't effective and we need to look at something else. And this can be the form of immunotherapy or desensitizing you to whatever you're allergic to. This used to be in the form of an injection, but more recently there are other options available, such as drops or wafers under the tongue. And these can be started with children from the age of 5 and above. If this doesn't work or it's not suitable to you, then there are other options as well, such as surgery. And this is something to be discussed with your ear, nose and throat surgeon at the time and can be tailored to your problems. So if you have any questions or concerns about allergic rhinitis, please do go and see your GP and ask those questions to them, and your GP can then contact an ear, nose and throat surgeon or other specialist depending on your symptoms.